Events happen that change our lives. Dealing with change is what we do. We discuss with industry professionals objective solutions to work through cherished items and family memories. When we go beyond the gavel, we provide tools and information to deal with these crisis times. Hi Omaha, it's Shayne Fili with Beyond the Gavel. I'm at Auction Solutions Inc. if you need an auction. Today we're going beyond the gavel with Nikki Wulff and Alyssa Jelinek. They are service providers for the elderly as far as home health care and if you need to relocate. Nikki's with Assistant Living Locators and Alyssa is with Right at Home. So which one of you, Alyssa or Nikki, would like to go first and tell us about your business?
I can go.
Take it away.
My name is Nikki Wulff again, and I own Assisted Living Locators. And what I do is I help families and seniors that are in transition from their current living situation. So whether it be from their home, from rehab, or maybe they're in the hospital and they're unable to go back home, it's a free service provided to the families. And then I also help them find the appropriate option for their care. So I take them on the tours, I help them figure out what is appropriate cost-wise, if they're gonna need Medicaid in the future, and then partnering with people like you that may need to help them pack, move, or have an auction, all the way through the move-in process. And then the communities are the ones that pay the fees so the family doesn't have to.
Oh, that is awesome.
Yeah.
And you have an affiliation with Alyssa, so tell me how that works, Alyssa.
Yeah, so Nikki and I work together all the time because our services are so complementary. So where Nikki helps when families are ready to make that move, Right at Home helps if you have someone who is just wanting to stay in the home, but they can't do so independently anymore. So our services, there's a wide range, but things such as light housekeeping, transportation, maybe if someone isn't driving anymore, bathing is a big one that will go in to help with mobility, dressing, things like that.
Okay, so are you allowed to give meds and do things like that, do therapies?
Yep, so we can we can administer medications. Right at Home is licensed through the state of Nebraska. So one thing I always want to educate families on is private duty home care agencies are not required to be licensed in Nebraska. We have our license, which just holds us to that standard where we do have the state overseeing our cares. We have a full-time nurse on staff. Anytime we provide hands-on service, it's by a CNA, and then that's then why we can do that higher level of care, which would be administering medications with a medication aid. We can use specialty lifts like Hoyer lifts, sit-to-stands. We do not do therapies, so we do not do physical, occupational, speech therapy or home infusions at all.
Okay, and I'm sure it makes people feel much more comfortable when they can stay in their home. How long can they, and what is the deciding factor when they must relocate?
So it is truly up to each family. Every situation's a little bit different. We have clients that we have been with for years and it's 24/7 care. Maybe they have Alzheimer's and they need 24/7 oversight for safety, and then maybe the spouse has the physical needs.
Sure.
And those families, you know, if their family bands together and decides we want to keep mom and dad at home, we can do so. We also will have families where, you know, financially it's not the best for them anymore, or maybe, you know, they just need that community. Maybe spouse passed away in their home and now they're all alone, maybe family's out of state. So we go in and we'll have those conversations. You know, is it going to be best for you to maybe relocate into a community where you'll have that, you know, just the community around you and the services at, you know, not private duty home care costs.
So do you also interact with the doctor's office to determine if they are needing to have that sense of community or to relocate? Is that part of?
So our nurse, Karen is her name. So used to saying that she will be in contact with our clients' primary care physicians as long as that's something that they have given us permission to do.
Sure.
Which it is really nice because we really are the eyes and the ears for the family, and we're in the home, we're seeing the day-to-day, you know, the way that individual is living. Maybe we notice there's some forgetfulness that's happening, or maybe we it is something where that companionship is just what they look forward to every time. And in those instances, it might be a trigger to say, okay, maybe we should pull in some additional resources.
Okay, so you do notification if it's needed to let someone know that we might have a change here?
Oh yeah, so we monitor change in condition is what we call it. So we can, cognitively watch for that. Physically, certainly we will watch for that also. And anytime there is a change in condition, it immediately, the caregiver will document it. It will alert our nurse and our quality assurance coordinator. Depending on what it is, they'll then follow up.
I see.
Yeah.
So where do you come in? You must come in when it's time for a change.
Right. And, the reason that we partner together and also with other home care companies, it just depends on the situation, is sometimes they want to try it out and see what it's like to stay home and have a private caregiver coming in. Sure. So that is why we work together so often, is giving them the chance to see if it can work, essentially. But where I come in a lot of times, for example, there was a client that I worked with Right at Home where he was living with his son and daughter-in-law, and that became taxing on their marriage. And so I would say it's like caregiver burnout to a certain extent.
Sure.
So we work together, and it would be better for him for his medication management. They were working with Right at Home but couldn't afford 24/7 care. And so just really being able to help him go to a place that he could have the social activities. He loved to go walking, do all those kind of things. And so I helped find a community for him. And he's thriving and doing a great job. And then the family, they kind of get to go on with their life and become the daughter and son again and not the caregiver. Sure. And so that's kind of where I fit into some, equation where we would partner together, and then vice versa. I send referrals that way when it's like, we don't want to do it during COVID. We want to wait till after winter. We want to see if this will work. So sometimes starting with home care is just getting them used to having a caregiver around.
Absolutely.
And then sometimes, the cost can play a part, because there is a pretty big difference in cost depending on how much care they need. And then just being really open and honest and talking about it with them. But I see families through the end of life. So my goal is to not go away after someone moves in.
Sure.
I want to work with that family, help them through issues. I just had a client the other day where her mom was in assisted living, thriving, doing great, but unfortunately she's declining to where she may need long-term care. And that's something that can happen. And she called me, and I love that. I don't want to go away. I want to be able to help if that's needed. And hopefully we can get her back to assisted living with some hospice services, because I help bring all those folks in as well.
Okay.
And give her, back to her home that she actually really liked. So that's kind of how I fit into the equation.
Well, that's really neat. Tell me a little bit how COVID has affected your businesses since March.
Yeah, you can go.
So when it all started, we definitely took a little bit of a decline, just because people, unless it was absolutely essential that they had care, it was just, let's eliminate additional people coming in if it can be avoided. But then as things started to open up, and as everyone kind of got used to the new normal, and precautions were put into place, we did start picking back up. And now we've actually seen an increase, because people are maybe bypassing moving right now because they don't want to be quarantined for a certain amount of days, or not have visitors, or people are, instead of going from hospital to a short-term rehab, they're just going straight home. So that's kind of where we come in, where we're able to, again, provide care in the home to keep them there until they do feel safe to then make that next step.
Absolutely.
But as far as our agency, we provide all of the PPE for our caregivers, so masks, gloves, hand sanitizers. In certain cases, we have the face shields, the gowns. It all just kind of depends, but we are also doing, before they can clock in for shifts, they have to go through all of the screening questions.
Sure.
If they answer yes to any of them, so symptoms, have you been exposed, it kicks a message to our office, and we, again, immediately follow up. If it's something, if it is a yes and something we're concerned about, we'll just actually send them to go get tested. We partnered with a rapid testing facility here, so we can send them. We'll pay for the costs. They can get their results within 20 to 45 minutes, and then we can determine what to do at that point. Yeah.
So what about moving people into facilities or a villa or whatever they've chosen for their next step? How's that working out with the COVID for you? Because I know some, if you take them out to go to the store, they don't get to go back in and things like that. So how's that affected your
So with COVID, I mean, kind of similar to Alyssa, it was really quiet at first. Everybody was pretty scared, but in senior living and separate from a nursing home, because a lot of the bad stories come from the nursing homes, and the reason is there's so much turnover, people coming and going, so they have a higher risk of exposure.
Sure.
But when you talk about assisted living or memory care, independent living, the exposure is much less because you don't have that turnover. But essentially, I'm able to be the eyes and ears for the family because some of them cannot go in and do in-person tours.
Right.
And so I can at least, tell them what I know about the property, what it looks like, what the culture is like. In terms of visiting, every place is so different. Right now, there are some communities that are allowing visits. There are also some communities that will let the family take their loved ones to a doctor's appointment, which is a great way, I know it sounds crazy, but to just see your loved one and to be able to put your eyes on them. And so sometimes that's a way for families to do that and have that connection. But there are some places that are really, I would say, conservative, and they're very much on lockdown.
Sure.
And it's window visits, and it's getting cold.
It is.
And so I'm really encouraging communities to come up with a plan, like what are you going to do? Because there are communities that have figured it out that are allowing in-person visits.
Sure.
And that's honestly what some of my families tell me is I only want to see the places that are allowing that and that have figured that out. If there's a COVID outbreak, if you will, or several residents, they're going to have to go back, to lockdown. But most places have done a really good job of keeping it contained.
I believe that they have, and I believe that they're taking every precaution that they can. My mother went to see her sister, or was scheduled to, but they're doing it outside. And the other day it was about 30 degrees, and my mother was more afraid of my aunt getting pneumonia than my mother, but she said, I don't want her to take the chance of getting cold because the visits were half an hour. That's a long time.
Yeah. So a lot of places are doing a conference room that's, somewhat spacious, and they'll have a plexiglass so you can actually see your loved one, talk to them, hear them. You're not on a phone talking through a window. And I think that the isolation, honestly, has just become so hard for our seniors that they need their family back.
I think so too.
I am an advocate for that if it's done in the right way and it's safe. And so any way that they can talk to them. Sometimes it's Zoom or FaceTime, but maybe you rotate and do a Zoom one day, come and visit in the conference room one day, and then do a window visit so you can see them in different lights. But for them to be isolated, it's kind of becoming a thing of the past. Most people are back to community dining.
That's great news.
They're not locked in their apartments unless they literally have just moved there. To be safe, they'll do a quarantine. Some places are making also changes with that, where they may only have a 4-day quarantine if they have a negative COVID test. And then they'll wait 4 days and retest them so they're not locked in their apartment for 2 weeks.
Better.
So it is a lot better, and the media can say a lot of things, and different areas are totally different about how they handle it. So it's definitely different per market. But here it's fairly open. You never know what the future is going to bring, but there are definitely options.
And you girls are pretty busy in the community as well, so you've developed an elder network of service providers. Tell us about that.
Yeah, so we always primarily want to be a resource. A lot of times if you're not in the senior care industry, it's overwhelming. You don't know who to call, who does what. So we always just say, call one of us and we will get you to who you need to talk to. Essentially, just you mentioning isolation made me think of another way, that we do bring other agencies in. For example, I have, referred to home health, which is going to be the therapies, physical therapy, occupational therapy, for a ton of our clients because of, if they are in an assisted living and they were in their room, they now didn't get to walk around the facility. They didn't get to go to their exercise classes, and they are weaker. So just another way to paint the picture that we really are, we just want to be a resource. Whatever they need, whether it's, contacting you for if they are moving, or maybe they are home and they don't have 24-hour care, but they need a button. We know people who have the buttons, so all different things. Anything you want to add?
I mean, I think it's just, to your point, the continuum of care, and I think that healthcare is like a maze. Trying to figure it out is a nightmare. I've been through it with my family. That's why I do what I do. And being able to say, I have pretty much met with most companies in Omaha to know what their reputation is, what are their rates, where are their service offerings. You know, they may not want to work in Blair because they don't have caregivers, but we have a company that can, or Fremont, and just knowing the markets and who's out there. So that way, when a family calls, I can say, okay, maybe I can't help you, but here are the 3 people that can. There are several free resources too, like Elderline for seniors for like legal advice. That's a free resource that we have here in Omaha, and it's a grant, and so many people don't know about it, and there are actually lawyers working that line.
Wow.
And so telling people about that, they're so surprised. They're like, thank you so much. Well, maybe I didn't help them move somewhere, but I helped them get connected, and hopefully they'll remember me in the end. So it's just really doing the right thing, and being that go-to resource is helpful for families.
And how many people are in your groups that meet?
Probably like 20 to 25. So we have like different networking groups. There are several around town. It's obviously different with COVID, some Zoom, some in person, but people from communities, home health, hospice, home care, gosh, you know, the gal that does life alerts and medication dispensers,
Elder law
attorneys. Yeah, so we have a really great network, but then there's always, you know, the people that don't do that, which is fine, and we have access to them as well. So it's really nice to just know our resources in the community and be able to share them with families.
I think affiliations is pretty much where it's at, because I think you need to be, if they ask you, you should have an answer. I like to look things up, but I also like to know to refer somebody that I already know. So I think that's a great plan that you guys have going, and, you know, good for you on that. So tell me about Medicare and how, if you're in a Medicare situation and going to a Medicaid situation, what have you seen, any changes in the year 2020 with or without the COVID?
So I'll just cover on mine, then I'll let Alyssa talk about Medicare and her business. How it affects me and my business is people that have a rehab stay at a skilled nursing facility, Medicare does pay for that. So if you go to, say, break your hip, you go to the hospital, you come back to a rehab center, and you get 20 days of rehab, Medicare will cover that. I haven't seen a whole lot of changes, but I'm also not selling Medicare, doing anything like that. So it's pretty standard. And then in terms of assisted living, I think it's important for people to know it's not covered by Medicare. It is completely private pay, long-term care insurance, whatever assets, you know, you want to have in the mix. So it is not, and a lot of people think that it is. Now, I will tell you, if folks don't have any assets to their name and they maybe have $1,200 a month in Social Security, they most likely will qualify for Medicaid waiver, which is a program that allows them to go into assisted living, or they can get care in the home as long as they need help with their activities of living. And it gets pretty deep, so I don't want to get complicated, but essentially a lot of people think they're not qualified when they are, because as long as your care exceeds what you're making, technically you qualify. And there are great resources out there for that too. The Eastern Area on Aging is probably the best go-to. They call them ANOA. And so if you ever need any resources on that, you know, contact any of us. But I'll let Alyssa touch on Medicare and her business, because it's also different how it works.
So Medicare does not reimburse for private duty home care. So our payment sources are primarily private pay. We do work with long-term care insurance. The VA is another big one. And then again, NOA, any government-funded program that would reimburse for home care, we will work with them. And then we also do take Medicaid waiver. So that's something a lot of people don't know or realize. And again, we want to be a resource, get them connected with the right people to get that ball rolling to see, are you eligible for it? If so, let's see how many hours you're authorized for, and then we can get a schedule put together.
Oh, that sounds great. Sounds you guys really have your thumb on what's going on out there. I find that
try.
very impressive. Well, if it's anything like my business, it changes all the time.
Yes.
What about certifications? You mentioned that you are licensed by the state of Nebraska and that you have a nurse on staff. Do you need any certifications or anything that you're working on or trying to get started out there or would like to see?
So technically in our business, it's not a licensed type business as of yet. So we are nationwide. One thing that I think is really nice is I'm part of a franchise. franchise. So we have 140 locations, and we do have to be held to a higher standard.
Absolutely.
So being part of the franchise, I have to have a certain amount of insurance. I have to have insurance to be able to transport clients in my car. Since there isn't necessarily a license, I do have that overseeing body, if you will, and also just to have best practices to be able to talk to other owners. I just had one of my clients here, her mother-in-law lives in Florida, and she's like, we don't know what to do, Nikki. Do you have any ideas? Well, I actually have an advisor in Florida
There you go.
who knows that market, is previous social worker, and she just texted me today that they found him, her mom a place.
Oh, great.
And so being able to make those connections, pretty much any city in America we cover. So if anything out of state comes up, but that's kind of how the landscape is in my particular business.
How about you, Alyssa?
So just the state license, I would say, but just kind of piggybacking off what Nikki said, we're also a franchise system.
Okay.
So Right at Home was actually founded in Omaha back in 1995. So we've had a local presence here for 25 years.
Guess so.
And yeah, so we are, the last 25 years, it's now a national, international brand. So just, having that standard to look,
Yeah,
look at
it's really nice to have that oversight. I'm part of the National Auctioneers Association, and that has been great because we have auctioneers in every county, every city, every state in the United States.
Yeah.
And we do refer as well. The auctioneers, I don't think, are on to the senior services yet, but I think it would be a good place for them, especially those that do real estate and estate sales, because I think it would be very helpful to them to be working with the senior networks because it would help their bottom line. And especially with COVID, many auctioneers only do live auctions. Well, we are in houses where people have moved or we've moved them. And all of a sudden, it's a little safer for our people, and it's a little safer for the people who have moved into another environment. So it's been a little bit easier for us to continue with our programs as well.
Yeah, that's awesome.
wonderful.
So do you have any questions about auctioning or senior moves or anything we can do for you while I have you here?
I think just how does it work with COVID? So client of mine, and I kind of told you a little bit about it, but they're in their home that they've had for 50 years, tri-level,
Yeah.
wanted to have a garage sale, is like, that's not going to happen. How does that process look if you were to come in and do the auction and then also possibly like the pack and the move?
Well, typically what we do is a site visit, maybe with you to do an introduction. Then we talk to them about where they're going, and we try to get a layout picture of where they're going. We take the items in the home that they must have. There's certain items that they must have. And then the items that they'd like to have, and kind of lay it out on a spreadsheet and see if those items are going to fit, and kind of go through that with them. Also then, if it comes to the packing, we get them packed, get the movers over there, get them loaded, meet the movers at the new facility or their new apartment. We'll unload and unpack and set up the apartment. Because I feel like a move is hard on people already. So if you move them and it looks like their bedroom and their living room with their doily on the back of the chair, I think that it's a little more helpful for them. Then we go back to the house and take a look, get it ready, sort through everything, make sure that their important papers and pictures are all put away into boxes so that the kids or family can come and get them. Then we set it up for an auction, and with our auction procedures, we go in and we take pictures of every item and we do a description. So if it's a Elon, sofa, seats 3, whatever, we give those information on there and take the greatest pictures that we can. We put it online on proxy bid for 2 weeks, then we close the auction, and we have gone to a scheduled pickup. It used to be everybody would just show up at the same time for their pick up their items that they won. Now we send them out, they pick their times every 15 minutes where they can come in, and that's been very helpful with spacing, spacing people out. And then we let 2 to 3 people in at the house at a time, and if we haven't sorted their items before, we'll help them find them in the areas that they are in, and then of course we stand aside if they're carrying out furniture. But it's been really helpful for us to implement things for COVID safety as well. And I think that the buyers really appreciate the way we're doing things now. When it's done, we can clean the house and get it prepared for showing if there's a real estate agent attached. If not, I'm a licensed real estate agent as well, and I can certainly list the house. I also have affiliate brokers that I use here in the Omaha area, so it's been working really well. And so we're pretty much, we can do the whole thing. We just had a family move half the stuff to Texas. We had the auction, and now we just sold the house. So we're really excited about that. And we'll be putting more on goldenyearsrelocation.com. We'll be putting more information like that on there and kind of showing people the way. We just took an auction today that is a 5,000 square foot house that's about half full, and then a 3,000 square foot building full of construction materials. So we'll be doing that one. So
Wow.
that'll be coming up too. And I don't think there's a job that's too big for us. We love business liquidations, but we also do the estate work too. And the senior moves has been a really good opportunity for us just to meet more people and to you got to be out there in the community doing what you can to help people.
Yeah.
Sure.
And it's wonderful that you are that one-stop shop for,
We really want to be easy.
Yeah.
And I think my biggest thing is when people are in their home, it might be a little 2-bedroom with just grandma and a dog, or it might be a 4-bedroom house, great big one. They have the feeling that their items are worth something. Maybe not new, and they probably had them for 20 years, but they're not new. And that's okay. There still is value there because there's still people who will buy and repurpose, especially wooden furniture right now.
Oh,
They hit it with a chain, they paint it, it goes to junk stock. They're repurposing all these things and they're not ending up in the landfill, which I really appreciate.
Yeah, makes the lives easier for the families, for the seniors, because they don't know where to start. So you
Yeah.
basically guide them and tell them what
We
to
do.
do and what to ask for certain items.
Yeah, and I really
That's
love
great.
what I do. Been an auctioneer for 22 years, and now with the senior moves, and we're going into year 2, and I really, really like that. I love seniors, and I love their families, and anything we can do to help. We also have something called Fair Split, so if there is a family that is having some issues about who was to get what, we can also do a catalog and put it out in a 3-round robin bidding process, which they choose the items that they want. The items that nobody else wants are obviously nothing to worry about, but once in a while we have to get an attorney involved, and it would be the family attorney to work out the items that all of the children would want and make that equitable. So it's kind of a neat.
That's a great idea.
Yeah.
super
tool.
helpful.
so
we all
needed.
know how family dynamics can
know.
play out sometimes.
Yes.
We do. Well, it's about time to wrap this up, and I want to tell you, Alyssa and Nikki, thank you so much for coming today on Beyond the Gavel. I am so glad that you were here. Ladies and gentlemen, we're Beyond the Gavel. Watch us. Tune in next time. Thank you.